Hello people, in this particular video we are going to discuss about bronchodilators. So what does the word bronchodilators mean? As we know, the word dilators means these are the drugs which dilate something. It may be muscles or blood vessels, etc. So the first part of the word, that is broncho, suggests that it is related to lungs. So finally, bronchodilators means that these are the drugs which dilate the muscles of lungs. So when the muscles of lungs should be dilated? In some medical conditions like asthma, in COPD, the muscles of lungs get constricted. That is, the blood vessels get constricted. In those conditions, when we use the bronchodilators, they relaxes the muscles and there is a free flow of air. So in conditions like asthma and COPD, we use bronchodilators. Finally, bronchodilators is nothing but the drugs used to dilate the muscles of lungs. Coming to the classification of bronchodilators are majorly classified into sympathomimetics, methylxanthines, and anticholinergics. In this particular video, we will study about sympathomimetics and the drugs under sympathomimetics. For the selective beta-2 adrenergic agonists under sympathomimetics, we have short-acting drugs and long-acting drugs. Short-acting drugs will show rapid action. It's like in minutes they show the action. In just minutes they show the action. Long-acting drugs take long time for showing action. Under short-acting drugs we have salbutamol and terbutaline. Under long-acting drugs we have bambuterol, salmeterol, and formoterol. The examples of methylxanthines are theophylline, amylophenolin, ethiophylline, and doxophylline. And anticholinergics are ipratropium bromide and thiotropium bromide. These are the drugs under bronchodilators and you have to by heart them. Coming to the mechanism of action of sympathomimetics. Sympathomimetics are the drugs which show positive action on beta-2 receptors. Which beta-2 receptors? Beta-2 receptors of bronchial smooth muscles. Sympathomimetics, they show positive action on beta-2 receptors, that is, they show action on bronchial smooth muscles beta-2 receptors, and they increase the cyclic AMP. And finally, bronchodilation will be occurred, that is, the dilation of blood vessels of bronchioles will be occurred, and they increase the histamines from mast cells. Coming to the individual drugs under sympathomimetics, for short acting we have salbutamol and terbutaline. These both drugs, salbutamol and terbutaline, are short acting drugs and they show rapid onset in just 1 to 5 minutes. And these drugs were used for the acute attack of asthma. These are used in the medical condition called asthma. In asthma condition, salbutamol and terbutaline were used to relax the bronchial muscles. Majorly salbutamol or terbutaline were taken through inhalation, that is route of administration through inhalation, or these are also available in oral, IM and IV routes. And under long acting drugs we have salmeterol and formoterol. Salmeterol is a long acting and short onset of action drug, whereas formoterol is a long acting and rapid onset drug. This salmeterol was used in moderate to severe asthma condition. Formoterol was used along with low doses of glucocorticoids for the relief of asthma symptoms. Both these drugs were inhaled. The other drug in long acting is bambuterol. That is, it is nothing but it is a prodrug for the terbutaline, where you have to remember that terbutaline is a short acting drug. And this bambuterol was available in oral route, and it should be taken once in a day. It has long duration of action. It has long duration. Bambuterol has long duration of action. All the drugs, that is salmeterol, formoterol, bambuterol, salbutamol, terbutaline, that is salmeterol, formoterol and bambuterol are long acting drugs. This salbutamol and terbutaline are short acting drugs. All these drugs have adverse reactions or tremors, palpitations, hypokalemia. What is hypokalemia? That is low levels of potassium levels in blood, and it rarely causes cardiac arrhythmias, that is nothing but abnormal heart rate. And now coming to the non-selective sympathomimetics, all the drugs that are salmeterol, salbutamol, formoterol, bambuterol and another drug terbutaline were selective beta-2 adrenergic sympathomimetics. In non-selective sympathomimetics we have adrenaline. In this category we have only adrenaline, and this adrenaline it is a powerful bronchodilator. It is a powerful bronchodilator, but it was not used because it shows adverse side effects. It shows more side effects related to heart problems, cardiac related. It is nothing but heart problems, right? So this was not used. So the majorly used drugs are under sympathomimetics. Majorly used drugs for the asthma and COPD are salbutamol, terbutaline, bambuterol, salmeterol and formoterol. So thank you, and we'll discuss about the methyl xanthines and anticholinergics in next video. Thank you.